Welcome to today's deep dive. I am thrilled you are joining us because today we are looking at a really singular, highly impactful set of data.
Yes.
It's from a document called The Social and Economic Blueprint of Depression. And our mission today is simple, but it requires a pretty massive shift in perspective from you, the listener.
A huge shift, yeah. Because we usually talk about depression as this entirely individual clinical issue, right?
Exactly.
Like a private struggle that is just happening behind closed doors, strictly between a patient and their doctor.
Yeah. But we are zooming out today. We are looking at this not just as a medical diagnosis for one specific person, but as this massive interconnected economic reality, one that is currently shaping our local communities, our workplaces, and really our overarching financial systems.
It is the architecture of our society, essentially.
Let's unpack this, because the first major nugget from this blueprint completely reframes the scale of what we are actually dealing with.
Right.
When you look at the demographics, depression affects roughly a quarter to nearly a third of a local population, up to a third.
It is a staggering proportion when you really let that number sit there.
Okay.
Up to a third.
Yeah.
And what's crucial to understand right out of the gate is that we absolutely cannot look at these simply as sterile statistics on some public health report.
Right. They aren't just numbers on a page.
No, not at all. These numbers represent our classmates. They're our coworkers. They are the neighbors living right next door to you. If we connect this to the bigger picture, when a condition reaches this kind of critical mass, affecting up to a third of a given community, it ceases to be just a medical anomaly.
Right.
It crosses a threshold. It becomes a baseline social reality. It means that literally everywhere we go, a massive portion of the people around us are navigating their daily lives, doing their grocery shopping, sitting in strategy meetings,
picking their kids up from school.
Exactly. All while carrying something incredibly heavy, yet almost entirely invisible.
I want you listening right now to actually visualize that for a moment. Think about your own workplace, or even just the street you walk down every day. If you look at 10 desks in your office or 10 houses on your block, the statistical reality suggests that 3 of those people are carrying this hidden weight right now.
3 out of 10.
It completely changes how you view a morning commute or a crowded coffee shop. This isn't some rare occurrence happening to someone else far away. It is right here in the room with us. And the data moves from that sheer scale into the very tangible ways this invisible weight ripples out into society.
It does.
Specifically, there is a statistic regarding the workplace that is just, it's hard to ignore.
The unemployment data.
Yeah. For individuals living with depressive and anxiety disorders, unemployment can exceed 30%.
30%. That is a massive demographic shift.
Yeah.
And we need to be very careful to look past the most obvious implication of that number here.
Right, because usually we just think about the money.
Exactly. Yes, a 30% unemployment rate signifies a tremendous loss of income, but the reality is about so much more than just a missing paycheck.
Exactly, because what does a job actually give us beyond the money? When you break down the specific elements that employment provides, there are 4 crucial pillars: structure, social connection, identity, and purpose.
The foundations of a routine.
Right. It really made me think of an analogy. Imagine a job is like the scaffolding of a building. It's the framework that holds up so many other parts of a person's life.
That's a great way to put it.
You have to wake up at a certain time. That's structure. You interact with colleagues, even just, grabbing a coffee in the break room. That's social connection.
Right. And you have a distinct role you fulfill, which gives you identity and purpose.
Yes. I know for me, just thinking back to when we all went remote a few years ago, simply losing the structure of a morning commute really messed with my baseline.
Oh, absolutely. It threw everyone off.
Now, magnify that feeling by 100, layer on a clinical mood disorder, and remove the income entirely. When depression actively interferes with that stability, it is like that scaffolding just collapses. The building loses its primary support system.
That analogy of the scaffolding is incredibly fitting, because what we are looking at is essentially a structural collapse of a person's daily life. When someone loses the structure, the connection, identity, and purpose that employment provides, they aren't just losing a place to go from 9 to 5.
No.
They're losing their anchor to the broader community. The data draws a direct line from that loss of stability to much deeper isolation and social inequity.
It really is a compounding effect, isn't it?
It is. Think about it. The depression makes it difficult to maintain the employment in the first place.
Right.
Then the loss of the employment deepens the isolation. That isolation, in turn, feeds the very conditions that make the depression so heavy to carry. It leaves individuals stranded on the wrong side of a widening social divide, completely without the very tools they need to bridge the gap.
So you have this structural collapse, you have this deep isolation. But that isolation doesn't happen in a vacuum. What keeps people trapped there?
That's the real question.
You might think the biggest hurdle is just a person recognizing they need help, but the blueprint points to something entirely different: stigma. It highlights how community stress and misunderstanding create actual formidable barriers to seeking care.
Yeah, stigma isn't just a vague, uncomfortable feeling.
Right.
What's fascinating here is how the mechanics of stigma actually operate. It is an active mechanism that blocks recovery. We are looking at a vicious, tragic cycle. People actively delay treatment because they feel judged.
Or they just don't want to admit it to their employer.
Exactly. Or, on a systemic level,
Sure.
they delay treatment because the resources are simply too difficult to access in a community that fundamentally misunderstands the condition.
Right. So let's trace out exactly what happens when that care is delayed, because it creates a very clear downward spiral. First, the care is delayed because of that fear of judgment. Or maybe the system is just too convoluted to navigate when you are already carrying that heavy, invisible weight.
Navigating healthcare is exhausting, even on a good day.
It really is. So next, because the care is delayed, the symptoms naturally intensify. You are left dealing with it entirely on your own.
Right.
As the symptoms intensify, the isolation we talked about grows even further. And finally, because the isolation is deeper and the symptoms are stronger, recovery becomes significantly harder.
Precisely. It is a cascading failure, triggered initially by misunderstanding and stigma. And we have to look at the end result of that cascade,
Which is?
the true social cost. It isn't only about the numbers, it isn't just an unemployment statistic or the sheer volume of a local population affected. The true social cost is the tragic sum of lost opportunities. Lost opportunities for connection, lost opportunities for stability, lost opportunities for support. When we let stigma and misunderstanding fester to the point that it actively prevents care, we are robbing our communities of the contributions, the relationships, and the presence of up to a third of our population.
Here's where it gets really interesting, though. Because we aren't just asked to care purely out of empathy, though obviously empathy is crucial.
Of course.
The data pivots to the hard economics of the situation. It puts a literal price tag on what happens when we let this condition go unaddressed. There is a specific massive number pulled from a British Columbia study.
This number is always shocking to hear.
It really is. That study estimated that major depressive disorder cost the provincial healthcare system over $1.5 billion over just 2 years.
1.5 billion.
And that wasn't even for everyone in the province. That was just for a cohort of newly diagnosed adults. $1.5 billion over 2 years.
It is an astronomical figure.
Yeah.
But honestly, as heavy as that number is, there is a crucial distinction we need to make here.
Okay.
That $1.5 billion, that only covers the direct healthcare costs.
Wait, really?
Yes. That is strictly the impact on the provincial system itself. We are talking about the clinics, the hospital visits, the formal medical infrastructure. It does not capture the full economic blueprint.
Wait, so the province is footing $1.5 billion bill, but you're saying that is not even the largest part of the financial impact. How much is falling on the individual?
This is where the math becomes truly alarming. Beyond the direct system costs, there is a shocking personal burden. For the patients and their families, the out-of-pocket costs can be 2 to 15 times higher than the direct system costs.
15 times.
Up to 15 times higher. And this is especially true in the early stages of treatment.
2 to 15 times higher. Let's really absorb the math on that for a second. Imagine the provincial system is spending $1,000 managing a patient's clinical care. That patient, meanwhile, could be burdened with up to $15,000 in personal costs.
Exactly.
And remember, this is a demographic facing a potential 30% unemployment reality. They're being hit with costs that multiply the system's cost by up to 15 times, while their income is essentially zero.
It creates an almost impossible paradox for the individual. You are navigating a condition that threatens your income and your social stability. Your scaffolding is collapsing, and simultaneously, you are facing a personal economic burden that totally dwarfs what the formal healthcare system is paying.
It's wild.
The system is essentially saving pennies by passing dollars of burden on to the individual.
So what actually makes up that 15 times multiplier? Because when I hear out-of-pocket costs, I just think of, paying a copay at the pharmacy. But it is clearly much bigger than that.
Oh, absolutely.
The breakdown in the blueprint includes therapy, medications, transportation, and time off work. And when you think about it, time off work isn't just an inconvenience.
No, not at all.
If you are hourly or if you have exhausted your sick leave, that is a direct compounding financial hit.
Exactly. And let's look at transportation for a minute. That isn't just taking a bus. It is the friction and the cost of physically trying to get to a system that is already difficult to access.
Right.
Maybe it's paying for ride shares because you are simply too exhausted to navigate public transit. Maybe it's paying out of pocket for weekly private therapy because the public wait lists are 6 months long.
Which happens all the time.
All the time. All of these expenses add up incredibly fast. It is a compounding economic pressure placed directly on the shoulders of the person who was already carrying that invisible weight we talked about at the beginning.
It is a massive misalignment. The individual is bearing the brunt of the cost, both socially through the isolation and stigma, and financially through these insane out-of-pocket multipliers.
Yes.
But despite how heavy all these statistics are, we don't end in this dark place.
Right.
There is an incredibly important and hopeful pivot when we look at the solutions.
There's a very clear way out of this. The data shows that early treatment and remission are strongly linked to reduced long-term costs, both financially and socially.
Which makes sense.
By catching it early, not only do we see a better overall quality of life for the individual, but the economic math completely changes.
Right, because if we intervene before the scaffolding falls apart, we change the trajectory.
This raises an important question about how we fundamentally view healthcare funding and resource allocation. If we know the vicious cycle where delayed treatment leads to intensified symptoms, harder recovery, and these massive 15 times multipliers in out-of-pocket costs, then the inverse must also be true.
Oh, I see where you're going with this.
Right. By intervening early, before the scaffolding of employment and social connection collapses, we interrupt the cascade, we prevent the isolation, we stop the out-of-pocket costs from multiplying, and we save those billions in direct healthcare costs over the long term.
It is the ultimate synthesis of all this data. Investing in accessible, compassionate mental health care isn't just something we should do because it's the nice thing to do. While it is ethically important, obviously, the numbers prove that it is also socially responsible and economically sound. It makes financial sense to care.
It really does.
It makes societal sense to build compassionate systems. We can actually afford to fix this, and frankly, looking at the billions lost and the compounding personal burdens, we literally cannot afford not to.
It's brilliant how these threads weave together in the text. By starting with the human element, the classmates and coworkers, and moving through the loss of structure, the barrier of stigma, and finally the staggering economic data, the central thesis becomes undeniable.
Yeah.
Depression is a blueprint that affects the entire architecture of our society. And changing that blueprint requires an upfront investment in early, compassionate care. That is the only logical response to the reality of the data.
So what does this all mean for you listening right now? It means that understanding this economic blueprint and these social ripple effects should fundamentally change the way we view the world around us. It changes how we look at our neighbors. It changes how we interact in our workplaces. It changes the demands we make of our healthcare systems. We aren't just talking about helping an individual manage a private struggle. We are talking about reinforcing the very fabric of our community.
And our economy.
Yes, exactly. This deep dive proves, using cold, hard economic data and sociological realities, that mental health really is everyone's business.
Well said.
And as we wrap up today, I want to leave you with a final thought to mull over, something to explore on your own that builds entirely on the logic we've unpacked today.
Okay.
If early intervention is the key, if we know it drastically reduces those massive 15 times out-of-pocket multipliers and saves billions in public spending, think about this. What would our society actually look like if we treated mental health checkups with the exact same routine, unquestioned urgency as a dental cleaning?
Or getting an oil change for your car.
Exactly. What if we built a culture that actively caught the hidden costs before they ever had a chance to hit the balance sheet or shatter a person's life? It's definitely something to think about. Thank you so much for taking the time to learn and explore with us on this deep dive. Keep asking questions, keep looking past the surface, and we will see you next time.